After cancer, it's completely normal to worry that it'll come back someday and that every pain, cough, or headache is a sign of it. And while it is important to be in tune with your body and monitor how you're feeling, constantly worrying about your cancer coming back isn't good for your mental or physical health. So if you are having symptoms, how do you know when to be concerned about cancer metastases and to see your doctor? Well, a good rule of thumb is if your symptoms are persistent, meaning if your pain, fever, or cough is taking longer to go away than usual, like say a few weeks, then it's important to get it checked out, especially if you're having similar symptoms to when you were first diagnosed. You know your body better than anyone else, so if your oncologist tells you not to worry or dismisses your concerns, it's okay to ask for a second opinion. It happens all the time. And don't be afraid to be pushy or persistent if you need to be. You at least deserve to have peace of mind. Most people find that their fear of recurrence tends to fade over time, and they worry less and less. But then reminders of past experiences can bring it up again and make you really anxious, like a follow-up appointment with your doctor, hearing about someone else's new cancer diagnosis, or the death of someone with cancer, or even driving past the hospital where you had your treatment. In general, most cancers tend to come back 2 to 3 years after finishing treatment. That's why it's said that your risk of recurrence tends to be lower after 5 years, and your doctor will likely tell you that you're in remission for the first 5 years, and you're not officially cancer-free until you reach that 5-year mark without any signs of recurrence. However, unfortunately, some cancers do come back several years later, and while you can't fully control this, there are things you can do to significantly reduce your risk of recurrence and give yourself peace of mind that you're doing the right things to help your body fight off cancer cells. I know what you're thinking. You're probably tired of hearing about how eating vegetables and exercising is the best way to prevent cancer recurrence, especially from me. But you may not have heard this before. Studies have shown that strength training can reduce your risk of cancer recurrence by 60%. That's a lot. And by strength training, obviously I don't mean pumping iron like Arnold Schwarzenegger, but you can just start off by lifting light weights. Actually, I should say the heaviest weights you can manage to lift without straining yourself. Lift them while you're sitting on the couch watching TV, or better yet, set aside some time to do a YouTube exercise video because there are a ton available for everyone from beginners to experts. Now, I know that eating spinach instead of cookies will help your body prevent cancer, but I feel like it's my job as a healthcare professional and as a cancer educator to remind you that everything you eat matters. Everything you eat has a direct impact on your gut health, your immune system, and most importantly, your ability to fight off cancer cells. It's been scientifically proven that people who eat less sugar and refined carbohydrates, like people who follow the Mediterranean diet, for example, have a healthier gut, a stronger immune system, and a reduced risk of getting cancer or having it return than people that eat these foods regularly. So at the end of the day, if you want to worry less about your cancer coming back, do some strength training at least 3 to 4 times a week and replace the sugar and refined carbs in your diet with some fruit and whole grain pasta or legumes. In fact, I'll link a video which you may find helpful to watch next called Eat to Beat Cancer. And if you found this video helpful at all, don't forget to subscribe to the channel so you don't miss out on more like it. Bye for now.